about ostomies. And one of the things that I do like to talk about is I want to talk about the stomas. And I also want to talk about how clients or patients feel. Because one of the things that you need to understand as a nurse is that it's a body image issue to have an ostomy. Does that make sense? If somebody has this on their body, they're going to feel uncomfortable about it. They're going to have body image issues. So you need to understand what that entails. One of the things that when you're doing any kind of ostomy care or emptying a pouch or anything, there's an odor to it. Has anybody emptied one in here, or is there an odor? Yes, there is a specific odor to it. And that makes the patient or the client feel very uncomfortable. And it makes you feel uncomfortable a little bit too, as you're smelling that, right? You're just kind of, so you got to get the poker face. You can't be, thank goodness for masks for our COVID. Sometimes that helps. But one of the things that you need to understand about ostomies is that it affects young people. So people with Crohn's that have a lot of issues are usually early 20s to late 20s, early 30s. So what do you know about this? What do you know about that age patient? They're active and they're normally sexually active, right? They're not dead. It's time for them to live. So they can live with the ostomy, and you just have to understand there's things out there. So one of the things, I did my master's clinical, and I worked with a person over at the local hospital here, the big one, and she is awesome. And I learned a lot about product, but one of the things that they had come up with, or a lady developed, was like Victoria's Secret. I think it was called like Leslie's Secret or something. Now you can get them anywhere and everywhere. But she made lace-like belts, and you put the pouch in, and then it came around the waist. So it hid the ostomy and the pouch. So if they wanted to be intimate, or they wanted to feel pretty or whatever with that, they could get that and put that on. It was a way to do it. And for men, it's solid. They can put it in, and they had solid ones that went around. And so it was kind of like made out of the material of what underwear normally is made out of, that cottony or whatever. Then I had a student this week ask me about swimming, and they actually have, we looked it up, they have belts that are waterproof, and you put the pouch and it goes over the wafer and it goes around them. And so they can get in the pool, they can get in the ocean or the water and not have to worry. Now getting out, they probably do have to change their wafer possibly, but maybe not if it's still, there. So there's stuff out there so that they can live and be active, okay? So the other product I want to talk about is product that you see. So when you're looking, has anybody been in where they've had ostomy products sitting over there in the hospital on the bedside table or over in the corner by the window? Well, one of the things when you go look, you're going to see a tube that looks almost like a tube of toothpaste maybe. And it says paste on it, ostomy paste or some kind of paste. Every time we think paste, we think sticky, don't you? I think glue. So, but it's not. It is not glue. It's not going to make the wafer stick any better to the patient. It's a filler. So with that, if you look at a stoma, they're sewed in. They come up. It's a diversion. The bowel comes up, or the ureter, and they come up and they become a diversion so that the person can have either fecal matter or urine coming out. So when they do that, it's sewn down in. You'll see little stitches if they're fresh kind of down there. But if you notice that the skin will go in kind of around there. So to get a good seal on your wafer, the paste comes into play. So you would size it, and then after you cut your hole around, then you can take the paste and it's called beading, and you just go around that opening, just a little thin layer, just like if you were putting toothpaste on your toothbrush or decorating a sugar cookie. You just go around, and that, when you push it up, will fill in that little uneven area and create a better seal, because that's the ticket to wafers and pouches and ostomy care, is you want a good seal, okay? So also another product that we use a lot is the All Care. Has anybody used this? It's the sticky stuff. We normally use it when we're putting on condom caps, to make it real sticky, and then you put it on hoping it will stay on. But what it is actually a protective barrier wipe. and it creates a very tacky surface, but it does create that barrier. So we will take the barrier wipe, and I'm going to show you, I'll demonstrate it here in a minute, but you're going to clean the area, and then you're going to prep it with this. If you need 4 of them, use 4 of them. Normally it takes a couple, and get this good and prepped, all even up by the stoma itself. Now, this will not hurt the stoma. The stoma has no nerve endings. You can touch it, squeeze it, do whatever. Please don't, because it is an intestine. You don't want to do any damage to it. But the point is it doesn't hurt the patient when you wipe across it or anything like that. There's no nerve endings. Where the pain comes in is the tissue and skin around it. And that's where all the nerves are. And so you can have a lot of skin and tissue, pain and discomfort due to just peeling it off and putting it on. Okay. And then also to deal with what's coming out can create some issue. So we also have another product that you might see, and it's a powder. It comes in, and this is an Ostomy Gum Powder. And so we can put our actual all care prep, our protective barrier on, and then sprinkle a little powder. It's not like baby powder where you need to, put a ton and the cloud goes up. You want to just put a little on, and with your gloved hands, you would just kind of rub it in to create that and help with the barrier, and also help with protecting of the skin, and then the putting the actual the wafer on. Okay. So in your product, when you're opening up, you have those. Go ahead and get out your I call it a stencil. You'll see it. It's in that right there. No, the paper stuff. If you take all that out and open it, it's in the little paper, and there's an actual insert. So take it out and open it up. And when you look at it, there's actual writing little beside each circle. It tells you in millimeters and in inches the size. Now, I'm going to actually teach you what your book teaches you, what NCLEX will expect from you, but I am going to give you a little pearl that I learned when I did the outpatient clinic over there for my schooling. So what you want to do is you have your ostomy, and we want to figure out what size do we need to cut our wafer to fit around the ostomy. So if you open up your wafer, and when you look at it, flip it over, the wafer itself that's in the square, it looks like this. This is a wafer. And then this is called the pouch. And you have a 2-piece system. So I have an extra wafer here that I can show you. So this is the wafer. And it's like a duoderm type material, and yours has that little bandage kind of cloth outside, which is nice. And then you have your actual pouch, which is this little piece here. And then you have a clip to close your pouch because you don't have a Velcro or a turn twist clip. So I need to, if you look at your wafer, you have all these little circles that are on it. And those little circles are going to help you keep going around. But I'm going to actually size my stoma, and then I'm going to draw on my wafer, and then I would cut that opening so that it will go around. Now, when you're sizing the stoma, you want to get it as close, according to your book and the NCLEX, around that stoma as you can possibly get. So I'm going to start to look. That looks pretty good, but let me see if I can get one. And that's too small. If you get it to where it's touching the actual stoma, you can cut the circulation off to the stoma, and you do not want to do that. It can create damage, just like you cut circulation off to anything else. It's like putting a rubber band on your finger. Same thing. We don't want to do it. So this looks pretty good. I like that. There's a little skin showing, but that's okay because we're going to prep that skin. So I look at that, and that is 1 3/4 inch or 45 millimeters. Now for my patient, I am actually going to mark with my marker this one so that the patient does know that we're going to use this one, as you can see. So then I'm going to take my wafer, and I just put my stencil right on my wafer, and I'm going to undo my marker. You can use a pen, a pencil, a Sharpie, anything you want. And I'm just going to go around making that circle so I know where to exactly cut for my actual ostomy so it'll fit. Then I just take bandage scissors or scissors that you get at the hospital for free and just cut that circle out. Okay, so that's how you would measure and fit your wafer. Now, when you are cleaning the patient, you want to take off everything if you're changing the wafer in the bag, and you're going to want to clean with soap and water only. Do not use the wipes that we have in the hospital to clean bottoms with. They have emollients and different things in those, and they create a kind of a greasy environment, and your pouch and your wafer will not stay on very well. So do not use those. Good old soap and water. Gently wash around and then pat gently dry. Get it good and dry. Let it dry before you start to put your product on. Now, they have no control of their bowel or bladder if they have an ostomy. So if they start to have a bowel movement, they just have it. They can't stop it. They can't do anything. So once you've cleaned this, take a clean gauze or whatever and just kind of lay it over, put it on there. And I always take a washcloth or a towel and fold it in half, or even a chuck if you have one of those pads, and just put it under. So if they have a bowel movement, it will catch it. And then you have a minor cleanup, not a major cleanup. Does that make sense? Because you don't ever know. You'll see when you start to do this, but that's how I do that. So once I've cleaned it, I've sized it, I've cut it, it's time to prep. So I'm going to take my all care and I'm going to start just around by the stoma coming out. And you want to put that all care all the way wherever it's going to stick the wafer. And if I need to get another, I can go around it again to make sure it gets real good. And then I want it to get tacky. I don't want to do it too soon. I want this to kind of dry. It'll dry. And when you can take a gloved hand, you can put your finger on it with your gloved hands and it's going to feel tacky. So I've got that on. Now, some patients will use paste, some don't. Some use powder, some don't. It just depends on what they're using. And some don't know what to use. And that's where the ostomy nurse is your friend. They're going to come up, they're going to size it, they're going to look at it, and they're going to recommend the product and tell them what to use and how to use it. And so once they do that, then you use what they say, and it helps. But say you get a patient, it's the middle of the night and everything comes off and you've got to put a pouch on. So this is preparing you for those days, and they will come. It's always that time. You're like, So I prepped it with the all care. And then if I'm going to put a little bit of powder, it doesn't matter if the powder gets on the stoma. It's not going to hurt it. Sometimes the all care can maybe just burn a little bit if there's some skin a little open near the stoma itself. And then I'm just going to take my finger and I'm just getting it all over. It'll come on down, get it on there good. So I've got it on there and I'm ready to put on my pouch on my wafer, which my pouch is a single. As you can see, it's a 1. It does not detach. You have a 2-piece. I have a 1-piece. So I've cut it. I'm ready to stick it on. So I'm going to go ahead and peel off. And starting at the bottom of my actual stoma, I'm going to put my wafer on from the bottom and then kind of go up. When you look through your pouch, you can see the stoma. And then I'm going to just gently press. Don't press on your stoma, but press around so that that material that's like duoderm material will start to stick. The ticket to this is that if it's their body heat and your body heat will make it stick better. So like duoderms, tegaderms, anything like that, including wafers, I always put my hand just over it and allow my body heat from the palm of my hand and their body heat from their body help start to mold that wafer to them and stick. Once it's good and stuck, then I'm going to go ahead and remove the little bandage, the little extra paper that's there. Once that's there, I take that off. I'm going to start to stick it around the patient. And you can see I'm going to rub my hands, making sure that I get a good seal with this bandage. Lift up your pouch and make sure that you come down and get it good and stuck to the patient, because the seal that you have is what's going to protect their skin. If it comes up, then you're going to have leakage out from underneath it. It's going to get to the skin. You're going to have leakage. If it pops off, then you have bowel movement everywhere, fecal matter, and then you have to redo the entire thing. So you want to get it really good and attached to the patient. Now, this one here is a twist. It twists open and it twists closed. So we've got it attached, it's closed, and it's on the patient. Sometimes you can get tape. There's different tapes that come in. If you have to, you can reinforce with some tape. You can reinforce with other tegaderms and stuff if needed, if they're new stomas and you're working with them to try to get what they need. Now, when they first come out of surgery with one, it's going to be bigger than what it's going to be. In the healing process, swelling will go down. It'll get a little smaller. They'll need to come to an outpatient clinic and be refitted. They'll get, measure and get new product. Also, that when they come out, there could be some bleeding or irritation. Don't be alarmed by that, but you just clean it with normal saline and then pat it dry, but always remember to prep. Now, if you have skin like that and you put all care on it, it can burn them a little bit. They're going to go, ooh, so I think there's a little alcohol to that, but it will burn just a little bit, but you need it to keep it sticking. Just remember that. So this is not a sterile procedure. So, you can fan them a little bit or whatever to help them with discomfort. Now, the other thing I want you to teach your patients is that if you only want it to fill a third to half full, don't let it get too full, because guess what happens? It weights it and pulls it off. The pouch will pop off or the whole thing will come off, and then you have a mess. So a third to a half full. Also, we all have bowel movements. We all have gas, flatus. So remember what you eat. Everybody eats different things that makes them very gassy, right? Broccoli, cauliflower for me. I just know it. And so teach your patient that, because they're going to have those issues too. And what happens is the bag will fill up. It blows up with gas, and you need to burp the bag. So all you do is open your bag, push the air out, and then close it back. Okay, so, and that keeps it, if it blows up too tight, it will pop off, and then you have the problem again, fecal matter everywhere, an issue. So it's real important. Now, the one thing that I like to teach patients when they go home is if they want to empty their bag, to sit on the toilet. Just sit down like you're having a normal bowel movement and just open it up and empty it into the toilet, and then clean it, fasten it back, and get up, flush, wash your hands, do everything, get rid of your gloves, and that kind of stuff. And then they're good to go. And it makes them feel more normal, because that's what we do, isn't it? We sit on the toilet to go to the bathroom. So it's a good thing to teach them. The other thing that you want to understand is your diet, the gas, is that when you're emptying the bag, and I want to show it on this bag, if you pick up your pouch and look at it, you can pick yours up, you have this little half like moon. It's like a cut. Now, I normally take it and make it a little bit bigger. I'll separate it and make it a little bit bigger for my patient so that it's easier to open the pouch. So open up your pouch and take a look. And when you go to empty this for the patient, teaching them, and as a nurse emptying them, when you go to empty the bag, just take it and fold it open. Do you see that? You fold it back, that plastic piece. And then you're going to just empty it. Then you would clean that end and take off your gloves or whatever, or empty the end. And if your hands are clean, your gloves are clean, pull it back and then re-clip. Because by doing that, you keep fecal matter off of the outer part of the bag. It keeps it clean, and it keeps the smell down. So you should always empty them that way. Now, I had a student say, well, it's always down and it's so full. Well, first of all, they need to be emptied a third to a half, right? So if I came in and it was so full that it was down here, I would, if the patient's in the bed and that's where they'd be, or back in the chair, I just push that back up enough. And then I would go ahead, even though fecal matter's on the inside there, right? Well, you have it clipped. So pull it back, and then you would have this clean piece, and you just want to fold it back. Again, fold it back and empty, clean it, and then do it and pull it back to where it should be and clip, and they're good to go. The ticket is to keep odor down for them, because that's one of their fears. The other thing that they can get are drops for gas, and they can put drops down into the pouch, and that will help with the smell of gas and the smell of the fecal matter, and that helps. They're just so worried about that, and I do understand that. You should too. We all don't go use the restroom in front of each other, do we? No, it's kind of a private time, and it's for other people. Now, The clip, you have a clip that has a little bow to it, and the bow goes towards the patient. My clip is a straight clip. So how to clip the bag is you take, the bag is attached, say, to here, and you have the clear part, and then you have this kind of flesh tone part. You don't want to fold it up, roll it up. Nurses want to go like this. We want to roll it 50 times thinking that's the best way to close anything, right? To close anything that you're doing. That is not true. We want to take it and we're going to just put the clip where the flesh tone meets the clear part, and I just want to come down and clip it. And there's a little lock on mine, and it'll lock just like that. Then I want the fold of the actual pouch to go up towards the patient's head. So when I'm looking at it, it will look just like that. That is strong enough to hold it. And the little pleats should go on like that. Now you have this little soft fleshy piece. If you have it on both sides, mine is one piece, so it automatically, you know which way to put it towards the patient. But what this is doing is preventing plastic to skin. It's like a soft, so that it's a barrier. So you're not putting plastic directly to the skin. Same with your actual clip. The piece that goes up should go up away. It should be outside, away from the patient, so it's not laying on them. Okay? Any questions? Okay, I hope this helped.